Hello there, all of you guys out there. This is a preview for episode 5 of the Alex Toast Medical Marijuana Logs. I say it's a preview because I have sad news. I got done with recording with my band Mouse Pocket, and I went to the store. It was a little bit after 9 o'clock, and they closed at 9, and I wanted to get a big dry erase board for some I guess lists that I think would be important to have a visual for. So I'm sorry, but the store was closed. Then I went to a different place, and they were still open, and they didn't have the size of the dry erase board that I needed. So yeah, now you guys, instead of getting a full episode, just get a short little preview of what we're going to be doing. I'm going to go over kind of some little bit more specifics about cannabinoid receptors, as well as specific things that certain cannabinoids can do and what they interact with as far as what receptors they go through and all this crazy stuff. But basically, I'm going to tell you guys this again in the episode, but quick facts, if you will. Cannabinoids connect to either CB1 or CB2 receptors, the two receptors found as part of the endocannabinoid system. So CB1 receptors work with the brain, specifically in the basal ganglia and in the limbic system, including the hippocampus, also in the cerebellum and in male-female reproductive systems. The CB1 receptors are absent in the medulla oblongata, the part of the brain that's responsible for respiratory and cardiovascular functions. So this is really important with marijuana because it's not connected with the cardiovascular and respiratory functions. There's not a risk for respiratory or cardiovascular failure from using cannabis, as there are with other drugs that are out there, different opioids and whatnot. So CB1 receptors are also responsible for euphoric and anticonvulsive effects of cannabis. It works with CBD and THC, as well as many other cannabinoids. CB2 receptors work primarily with the immune system, with the greatest density found in the spleen. They are also found in peripheral nervous system and in the cerebellum. It's responsible for anti-inflammatory and possibly other therapeutic effects of cannabis. And CBN, which I'll talk to you a little bit about in the next few days, it works with the CB2 receptors work really well with CBN, and CBN is a product of degraded THC active. Now, I'll get into that a little bit more specifically later, but just so you guys know, we're going to be going a little bit more heavy duty into CBD and its different effects as an antipsychotic, anticonvulsant, neuroprotective, vasorelaxant, antispasmodic, ischemic. I'll have to look up how to say that word. Anti-proliferative or anti-cancer, antiemetic, antibacterial, anti-diabetic, anti-psoriatic, maybe, intestinal, anti-prokinetic, analgesic, bone stimulant, anti-inflammatory, and immunosuppressive. CBD, one of the cannabinoids found in THC, and that they're trying to breed more heavily. We're finding a lot of stuff about cannabis and its specific chemical properties out. So I'm really sorry that I didn't get a chance to give you the full episode, but there's a little briefing of what we're going to be doing. Full episode 5 coming at you tomorrow when I get a chance to have a cool dry erase board behind me. Yay! Thanks a lot for tuning in. Preview episode 5. Have a good day.